period to really make that effort towards sequencing a vaccine for that for this particular virus. So other key times in August, and the third leading cause of death in the United States uh, became COVID-19, second to heart disease and cancer. So
That
one
was
heart
so weird.
disease, two cancer, then three COVID back in August of 2020. Then on August the 28th, there was the first known case of COVID of reinfection in the United States. So kind of again, just tracking how things are happening and the need for us to get to the point where we do need to have a better process of attacking COVID. So then on September the 28th, we were able to note that the global deaths surpassed 1 million, another key element. So that was September when that occurred. Then November the 16th and November the 18th, Moderna and Pfizer announced their vaccine efficacy, and that's really where the crux of this is. So 94.5% efficacy in the Moderna, and then in the Pfizer, they announced a 95% um, efficacy rate, meaning that if you take the vaccine, um, the likelihood of you getting COVID would be not happening at that rate. Then on December 11th, the FDA gave emergency use authorization for COVID-19 through Pfizer. And then on the 18th of December, the COVID-19 vaccine from Moderna was approved back then through emergency use authorization. And so with the emergency use authorization, again, that's an important element so that allows for these companies to really be able to get distribution going and be able to manufacture and distribute the virus in ways unlike other vaccines in the past because of the need to really get this out for to really combat the pandemic. So then on the 21st, other key elements around this is that we noted on December 21st, the COVID-19 variant circulating in the UK was found in the United States, and it originally originated in Colorado. And right now we have about 611 cases in the United States of the UK variant. And again, so we have the original COVID and then the variants coming up, which is trying to attack what could happen with the vaccine. And then there you've also heard of two others, and I'll just mention those. One in South Africa, and we have about 5 cases that have been found. And then in Brazil, there are roughly 2 cases here in the United States. And now, let me just do 2 more things, then we'll get to the questions. One, I'll talk a little bit about the Pfizer vaccine and a little bit about the Moderna. They're both messenger RNA vaccines. Now, so what that means is that they are able to provide instruction directly to your immune system of the spike protein that originates on the virus itself. And so that spike protein is encoded in the mRNA that gets injected through the vaccine into your arm, and it efficiently creates a specific immune memory within your body in order to fight the vaccine. The mRNA can neither interact with nor integrate into the DNA while it's inside the cell. So it has no capabilities of interfering with your own DNA, and so that just won't happen. Key elements of the vaccine itself by Pfizer is that one thing to note that I mentioned earlier, but in the creation of vaccines, they went through all the different phases. And so in the last 3-4 phases of vaccines, phase 3 is the one that is really obviously key. And that's when you really find out how well or poor a vaccine works. And so we were able to find out that the Pfizer was 95%. And then also, if you drill down into the data, other thing that's notable also is that, across age, sex, race, and ethnicity, if you drill down deeper into that, and also looking at underlying medical conditions, it showed a high efficacy as well. It was over 92%. And also, if you look at the ages, efficacy among adults, if you drill down just in that portion of the data, those over 65 years of age was at 94.7%. So numbers that are really kind of like, not usual in vaccines and the creation of vaccines. And the other thing that there were no deaths. And so what happens when you take the vaccine, symptom-wise, it may include pain and soreness at the injection site. And it most commonly occurs in about 7 days, but usually on the, day one. And in addition to that, you can get some fatigue, a headache, and muscle pain would be the most common. And usually this would last up to about a day. And the vaccine itself is authorized for the ages 16 and over. You would get 2 doses in the intramuscularly in your arm, 3 weeks apart. So these are some of the differences. So 3 weeks apart for the Pfizer. And the vaccine itself needs to be stored at sub-zero temperatures. Again, an important feature of the vaccine at negative 94 degrees Fahrenheit. So that means it needs to be in freezers that are capable of getting down to a negative 94 degrees Fahrenheit. So that's important. Now on to the Moderna. It's also just like the Pfizer vaccine. It's an mRNA vaccine as well. And its data, highly sensitive also, and its efficacy there is 94.1%. And so really just, not dissimilar to the Pfizer vaccine. And like the Pfizer vaccine also, there are some elements that are mentionable. If you drill down in the data there, if you look at also analysis across the ages, the sex, race, and ethnicity in ethnicity categories, and also underlying medical conditions. Adults 18 to 64, it's 95.6% efficacy rate there. Greater than 65 years old, 86.4%. And if you're greater than 75 years old, it was 100% effective. So again, very high numbers, very, very good to hear about these vaccines. And so in terms of side effects from it, similar to those from the Pfizer. Symptoms are really much the same. However, the differences here with this one is that the ages for the Moderna is 18. So again, Pfizer 16, Moderna 18. And again, you need to have 2 doses, and the difference, Pfizer, 3 weeks between the 2 injections, and then 4 weeks for the Moderna. But for this one, still sub-zero temperatures, but this one is a little bit less at -4 degrees. And so there are a lot of other key features about the vaccines, and I could possibly talk about these all day. So just in sake of time, I'll just stop there with some of the data that I have and just go ahead into the questions and then see if I need to comment more on any of those salient features with the vaccine.
Dr. Seamster, thank you so much. I have 2 very quick questions that I think you can answer quickly that would help set the table. And then there's some questions in the chat that Khalida can ask us. Question 1 is it safe? Period, and then secondly,
yes,
should we be eager to get it as soon as possible in light of some of the historical context of the medical field and vaccines and injections with African Americans throughout the history? Should we be eager to get it? Those are some of the questions that I get all the time. Yeah. And I just want to get your professional opinion. Is it safe? You said yes. And should we be eager to get it? And I guess the third question is how and where, if you know that may be out of your area of expertise, but how and where? Okay.
Okay. So yes, so those are great questions, and certainly that we are all, focused on the safety of it. And so when vaccines are developed, they go through a number of stages. And stage 1, I commented on phase 3 of the development of these vaccines, and that's when they really go out and get tested to see if they really work and they make a difference. But in phase 1 and 2, that's when the safety portions of the development of vaccine occur. And so it's first in phase 1, it's looked at in the clinical stages of it, the preclinical, looking at, you know, what happens. They first start out in looking at what happens in, you know, animals basically, and then they move on up to humans and only use a few people to really look at that. And it was found at those earlier stages that it was safe. And then obviously in phase 3, continue to look at the safety of the vaccines. And as I mentioned earlier, you know, what really happens when you do take the vaccine, the basic thing that occurs is that you really get some tenderness at the injection site. And other than that, it you know, may cause you to have some muscle aches and so forth. And so, yes, it is safe. And yes, it did go through the process, even though it didn't take as long as usual to develop these vaccines. But again, it started over you know, 10 years ago to 15 years ago, looking at you know, these vaccines in this area. And so we can be comfortable that it's safe and that it is a vaccine that we should take. And then, so why should we take it? Well, as you know, the numbers are quite staggering for, you know, the illness that has been created around COVID, and certainly the death that has occurred around COVID. And you know, we have certainly pause and cause to really think back to historically, you know, some of the issues that have gone into communities such as you know, African Americans and other minority communities, Black and brown communities. And it's important for us to really note that, but then also know that respecting what occurred in the past and knowing how we need to be vigilant, that you know, these vaccines were developed with those thoughts in mind. And so there are teams involved in making sure that these vaccines were done in an appropriate way, in an appropriate manner, so that we can feel comfortable about that. And if we do not participate in this process, we really subject ourselves, we subject our families, we subject our communities to being subjected to COVID. And the sooner that we get as many people vaccinated as possible, the sooner that we are, as a nation, as a community, able to really mitigate the virus from replicating. And as this virus continues to replicate, it has more opportunities to become a different virus, which would create a different set of issues for us, and making the possibility of creating more infection more potential. And so we really should take the vaccine, and really should be encouraged to do that, and really should feel that it's safe in that process. And how to get the vaccine? Well, as you know, we have had distribution issues because it has been a challenge to really get enough vaccine developed and enough vaccine manufactured to put out. And so there are various teams that have been put in place, and from a national standpoint and in the states, in order to come up with a plan to really make sure that we vaccinate as many as we can, but also do it in a logical manner where it can help mitigate the spread of the virus, and also be able to put in place a process that would help to protect those that are really protecting us as we move forward. And so it's important that we continue to do the things that we need to do in order to really help ourselves as we go. And that would be with making sure that we continue to wash our hands and distance and so on, that we know so well now, that we continue to do that until we're able to get in contact with the vaccine.
Thank you, Dr. Seamster. We have quite a few questions in the chat. The first one is a two-part question.
Okay.
It is it possible to get COVID-19 multiple times? And the second part to that question is, why get the vaccine shots if they don't really prevent you from getting COVID-19? Thank you.
Okay, so yes, you can get COVID-19 again. I mentioned that earlier, that there was a case in August where the first case that was recognized that someone did get COVID and then got COVID again. You know, as time goes, we're going to continue to learn about this vaccine, and there are cases where the virus can start again, and so the research is really looking at, you know, how that happens. But one, we should certainly get the vaccine, because what happens when you do take the vaccine is that it, one, at least with the vaccines that are out now, certainly the two that are out, none of the people in the study died from it. That's number one. And number two, in those patients who did get COVID that took the vaccine, their symptoms were less. They were not needed to be hospitalized. And if they did, it was not as a serious case as can occur with COVID without being vaccinated. If you think about, you know, treatments that occur for anything, there's a continuum of how a response of the human body is to that. Some people will respond differently than others. And so if you think about those that will not take the vaccine, then you really set yourself up for not having a response from your own innate body to respond to that, and which you would have a better chance of responding if you did take the vaccine. And so it's very important that we do, and have an opportunity to really, one, have less illness, but number two, make sure that we're able to live past this. And number three, that we want to also make sure that we are able to group as a communities to be able to have what's called, you know, herd immunity, which will help prevent the virus from taking charge and being able to find ways to survive and get through making what we're currently in place effective. So it's very important that we're able to do that.
I'm sorry. I'll go to the next question. Thank you so much. And if everyone could please mute your phones, that would be very helpful for all of us to be able to hear. The next question is, you mentioned part of this, but would you please rank the vaccine options in order of prevention and efficacy? And would you also give a recommendation on which would be good to give your children?
Okay, in terms of which vaccine would be best to take, I would take either vaccine. So if you're called or if you have an appointment to get the vaccine, whether it's the Moderna or if it's the Pfizer, I would take either one. I wouldn't choose one over the other. There may be some small differences in there, but the efficacy rates are about the same, you know, 94.5 and 95%. So I wouldn't allow that difference to really come into play here. The thing about the vaccines and the differences in the way that they're developed, the importance for that would be when the vaccines are taken to other countries. You know, here in the United States, certainly the vaccine and the temperatures would have a difference for those vaccination sites to be able to have the freezers that keep the vaccine at that temperature. But when you look at, you know, other countries, that's going to even be more of a disparity in terms of the ability for that country to do that. So, but here we need to just take the vaccine, whether it's the Moderna or the Pfizer vaccine. I don't think that makes a difference. Now, age-wise, the Pfizer vaccine is 16 and up, and the Moderna is 18 and up. And so the vaccines have not been approved for kids just yet. Those studies are going on right now. And we're looking to really, again, use that practice to see if we can get down to being able to vaccinate kids, but that hasn't occurred yet. It hasn't gone through those phases of the study yet. And so once we get there, we'll be able to make those recommendations.
Awesome. The next question is from a fellow anteater. There's now talk of second injections are not necessary. What are your thoughts on this?
Okay. I think we need to make sure that we follow the process for how the vaccines were studied in order to really assert the effectiveness that we know to be the case. We need to go through the process of Pfizer vaccination 21 days later, second dose, Moderna vaccine, and then 28 days later take the second dose. And this way you are able to get an immune response that is felt to be comfortable enough to really attack any the virus when you get exposed again. And so it's important that we do that, because the first dose then it has the ability to be primed again, so that the body really learns to be able to fight the vaccine. And that's what the second dose in these particular mRNA vaccines are doing. And the mRNA vaccines, now this is new technology in that, again, it's been worked on for years, and then now we need it because we're in a pandemic. Obviously, that needs to be mitigated down to levels where we can really get a better handle on it. And so I think we need to just go through the process of taking the vaccine as recommended.
Wonderful, thank you. The next question is addressing the variants that we're seeing from other countries, which you mentioned earlier. Considering the new variants that are being discovered every day practically, are we protected if we have taken the Moderna shot, the first one yet?
Yeah, so there hasn't been any concrete evidence that it does not. There are surveys, the blood samples are being checked randomly for those that are taking the vaccines now, and checking to see if they do have any evidence of being exposed to those variants. The variants that are in Africa have been noticed to be, if you will, more virulent, and there's a low number of cases that have been found in the US, and also Brazil, the same thing, but low numbers of cases being found. But there hasn't been a case yet where they found that they have not worked, and so they do work. And so again, if you take the vaccine, the intention of that is to really mitigate the level of the replication of the virus that occurs. So if you take any of the vaccines, it will mitigate the number of copies that your body would produce, which makes it less possible for your body to react to the virus as a foreign object and cause those various reactions that go on to create illness and high level disease within the body that causes much of the death that we've seen and much of the lingering illnesses that we've seen. And also thinking of those that do recover to really mitigate any chronic illnesses that we haven't learned may occur once this happens.
Thank you. The next question sounds somewhat familiar, but could you give us the salient differences between a Pfizer vaccine and Moderna vaccine?
Yeah, the main difference is that the age of those that can take the vaccine, so 16 Pfizer, Moderna 18, not that much great of a difference, but those two. So it's been approved for 16 years old and 18 years old. And the actual efficacy is a little bit different in the numbers, but not that grave. So one 95%, the other 94.5%. And I guess the other is the storage. So in terms of, they both need to have sub-zero temperatures. So in the negative 90s for the Pfizer, and -4 degrees Fahrenheit for the Moderna. So those are some of the salient features. Not that different. And so I think that either vaccine would be worthwhile taking. So if you get your vaccine, just either one would be fine.
Great, thank you. The next question is in regards to one person in the household being vaccinated, but the spouse or other household members have not. how efficient is, or yeah, how efficient is the vaccine for the person who has been vaccinated?
The person that's been vaccinated, vaccine would work in them. That's the study numbers that I spoke of would come into play. Those in the household that have not been vaccinated will still need to make sure that they are signed up and ready to be vaccinated. You will still need to continue to do all the measures around making sure that you're keeping safe. Even the person that was vaccinated still needs to do all the things in terms of wearing the mask, frequently washing your hands, social distancing, and so forth, as it relates to when you're out. And so you still need to do those things that you would do if you had not been vaccinated. So we need to operate in the same vein as if we had not been vaccinated, but know that we have been vaccinated.
All righty. The next question, I believe you already answered, but just to be certain, the vaccine, could you speak to why the vaccine is not available for children younger than 16 years old?
Yeah, it wasn't studied in that age group. And so you can't use the vaccine for that reason. Studies are going on now, and they are ramping up to really get there to the point where we can know what the efficacy rate is in children and what the safety is around children. So we have to go through that before we do that. And so we need to continue.
Understood. Why is the Johnson & Johnson percentage the vaccine from Johnson & Johnson percentage lower than the 2-dose vaccinations?
Okay, Johnson & Johnson, we didn't talk about that one. That one just came out. And then on Thursday, they did submit for emergency use authorization. But the Johnson & Johnson vaccine is a different type of virus. It's something called a viral vector vaccine. And what that means is that it takes a virus that we've heard of, the common cold virus, that is inactive, and it's able to basically put together an immune response that acts in the ways that we are usually more accustomed to in developing viruses. That's one. Number two, the other two, when we studied those, they were a lot earlier in the pandemic, and we really did not have the variants available at that time. And so when we get the study results from the Pfizer and Moderna, it was under the auspices of not having the variants. But then when you come to Johnson & Johnson, which started in around September-ish, in terms of when they started the phase 3 studies, they did them in Africa, they did the studies in the Latin American countries, and they did studies in the United States. And as you know, the variants were available at that time. And so that particular study was exposed to the variants. And even with the exposure to the variants, the numbers are lower in terms of efficacy, but nobody died. The illnesses that was, the level of illness that was created was a lot less. And so one could take from that, then, that if you take the Johnson & Johnson, then you would have a vaccine that is known to have been efficiently effective for those variants. And so there's the good thing about that. And so when you look at numbers, it's good to look at why those numbers are the way that they are. And so with the Pfizer and Moderna, we're learning now what truly may happen with that. Even though we haven't seen anything yet, the Johnson & Johnson has been tested with those populations in high numbers, and in those countries where those numbers are prevalent. So it's good in that regard that we know that. And again, so that means that we will, if it is approved for emergency use authorization, that then we know that that particular vaccine has that set of data with it, which gives us more information in terms of how we can proceed and be able to have choices around that. And so I think, again, another good result for what we need to know as we move forward in the fight for this pandemic.
Okay, we've got a little bit over 15 minutes left, so I'm going to have to go faster. So the
Okay.
next question is related to the rollout. Do you have any insight on how the vaccination schedule will roll out to, in particular, to people below the age of 65 years old?
Well, it's going to roll out based on the level of production. So the more that we get, the more these tiers will change. And so if we're able to get more vaccine, as you know, initially for both, we were able to purchase 100 million doses, and then that was done again, 100 million doses. And so if we're able to get those in a relatively rapid fashion, then those that will be added to the list will continue to be increased. And so it's just going to be tough to know how rapidly that will happen. It's something that we're going to have to live through and just be vigilant and just make sure that we're continuing to follow the protocol for protecting ourselves. Those that have taken the vaccine, but certainly obviously those that haven't, we all still need to be doing the same thing around protecting ourselves. And so there's no way to really know how quickly it's going to happen, but we have been told that the production rate is going to go up, so the manufacturing rate will go up. And so we're just hopeful that does occur in short order.
Would you elaborate a little bit on those who have taken the vaccine continuing to wear a mask?
Yes, you need to continue to wear a mask. So if you go out and you're in crowds, and you're not in your household, if you're not wearing a mask in your household, you can continue to do that. You can continue to do the same things that you were doing as before taking the vaccine as after. You still need to make sure that you are practicing the same protocols, because the issue is that we don't know if someone has had the vaccine, they may not themselves become quote unquote symptomatically involved from the infection, but someone that has not had a vaccine, and those that have not been exposed to the virus, you can still pass it on. And so it's important that we continue to practice those measures so that we don't spread it. And that's why it's so important that we continue to practice those measures. And as we learn more, we'll say more. But right now, we still need to all do the same things.
Wonderful. Are you offered a choice of which vaccine to take, or do you just take whatever's available?
Usually what happens is that the sites will have a particular vaccine, and then so those that are showing up are going to have to take what's available. Now, again, I don't recommend just getting out of the line because you may have a choice over Pfizer or Moderna. That's all that we have right now. I don't see any significant difference in making that choice, and I would just recommend that when you're able to get the vaccine, that you get it. Because right now we need to do all that we can to get as many vaccinated as soon as we can. Again, this is paramountly important that we begin to halt the virus from replicating. When it replicates, it has an opportunity to become what we've been calling, variants. So we don't want the virus to change what it is so that it can become unknown to the vaccines that we have. And so as soon as we get down the road in this process, the better it is for all of us.
One couple has a 20-year-old granddaughter who's tested positive for COVID. She's got all the flu-like symptoms. Should that granddaughter be taking over-the-counter meds while she is quarantined?
Certainly you should take medicines to help you feel better, and sort of routine over-the-counter medications would be fine. There should be certainly an opportunity to speak to the primary care physician about that. Certainly we can do telephone visits, video visits, and so that should be happening also in order to really speak to what's going on in that particular situation. But yes, it would make sense for there to be some intervention to help certainly to feel better with the illness.
The next question is in regards to the mRNA, messenger RNA. The vaccine sends a message to the body, as you know, and creates antibodies. But where did the protein come from that was used to develop the vaccine? And how do I know that the source is compatible with my RNA?
Okay, the messenger RNA, so what happens is that the way the vaccines are put together is that they have the messenger RNA that when it's injected, it goes inside the cell and it sits, the messenger RNA sits inside the cytoplasm of the cell, and then you have the nucleus of the cell. But once it enters into the cytoplasm, the mRNA develops the protein that goes outside of the cell and begins to create the process that starts the development of immunity. And so that messenger RNA does its job, and then it's dissolved, by the cell itself, and it does not interact with our own DNA at all, and it has no connectivity with who we are or what we will be in the future. So the only thing that it does is helps the immune system to identify to what the virus looks like, which is, if you think about the virus, it has spike protein on it. And so that protein is spike protein, and that's what the body learns to go after when it attacks the virus. And so the actual mRNA has no connection to the DNA capabilities of the human cells at all. It's all messenger RNA, which is that part of the development of the proteins. And so the ingredients in the vaccine would include the messenger RNA. It would include lipids, which basically is comprised of, like polyethylene glycol, cholesterol, and some other fats within the lipids. It has salts that we commonly know of, and it has maybe some sugars and some buffers to make all that so that it's able to be stable and to be in the body and do the things that it does. So there's nothing in there that is virus. There's nothing in there that's gonna be able to do anything to our genes to do any harm in that relationship.
Got it. Okay. What happens if you mix the doses of the vaccine from different manufacturers?
Okay. Now, so the two vaccines again that we have, they're both mRNA. It is not recommended that you mix the vaccines at all because that's not how the vaccines were studied. And so when you do a study, you need to follow, in terms of getting the results, you need to follow that process in the way you provide the vaccine. So, however, if you get the first vaccine and it's with one of the mRNAs, whether it's Pfizer or Moderna, again, it's recommended that you get the same one for the second dose. But for some reason where you got the vaccine, you don't know, they don't know, then you can go ahead and get the second dose up to up to the same timelines that we have for the vaccine. You take the one that you are available at getting and then go ahead and take the second dose. Yes, that has a potential of being mixed, but the reason that it's recommended that we do that is that you will have the opportunity to have some benefit from getting a boost of a response for your immune system, to not waste the first dose that you have. And so then you would certainly obviously be followed by that in terms of, with your healthcare professional, and also we would certainly inform the CDC about that, and then just see what happens in that regard. So you would go ahead and get that second dose based on that.
Dr. Seamster, we have about 7-8 minutes when we typically stop.
Okay.
We have several questions left. I asked Khalida to kind of scour the questions that are left and try to get the most impactful.
Okay.
If we go over a few minutes, would that mess you up?
Not at all. I'll be more than happy.
Will you give us kind of a max? Is it another 10 or 15 you can do without messing your schedule up?
15 is fine. Yes.
Okay, so ladies and gentlemen, we'll go about 15 minutes over max. So please put your questions out there. And if we don't get to them today, maybe we can have an offline conversation, Dr. Seamster and I, and we can maybe share some of that information. But this has been very, very powerful. And just as a friend and a brother, I'm so proud of you. You've taken all these questions and going for it. So thank you.
Well, thank you. Thank you for having me. I'm glad to be here and be able to help in any way that I can.
Okay, well, you are helping. Thanks.
Yes. The next challenging question, there are cases of Bell's palsy that we're hearing about. Should we be concerned as a result of taking the vaccine?
Well, there are cases of Bell's palsy, and in terms of the numbers that occurred in these particular studies, they were the numbers were not any different than what would occur in those that did not take the vaccine, and so the level of difference wasn't great enough to say that these vaccines cause Bell's palsy. So yes, some of the candidates in these studies did get Bell's palsy, but those that didn't take it, those candidates got Bell's palsy too. So it's kind of hard to say that or conclude from these studies that it causes Bell's palsy. So that would be my response to that.
Got it. Mm-hmm. So the next one is kind of two-pronged. What if you have severe allergies, or does the vaccine have any adverse effects for folks who are taking medications?
Okay, for medications, there's not anything that came out at this point around that, but certainly, just like with anything, there are reasons that we can be allergic. For example, people are allergic to peanuts, shellfish, and so forth. The ingredients in the vaccine, I kind of commented briefly on those things. The mRNA is there, the lipids and salts and so forth, the sugars and the buffers is in the vaccine. And so there are some of us who know that we have allergies when we take vaccines. And so what usually happens in that instance is that with your primary care physician, you would have protocols in place for how you take vaccines. And so if something is known for these vaccines, you would use the same process in terms of that. Now, also, there's levels and degrees of the way that we can be allergic to something. And there's something called an allergic reaction, and there's something called an anaphylactic reaction. And so wherever you get the vaccine, one could be allergic to things just by learning from a new standpoint. And so at all the sites, they should be equipped with making sure they're able to respond if someone does have an allergic reaction. So having like, Benadryl, the epinephrine and the steroids that you would have to take when you do get a reaction like that. But that has not been a preponderance of any of those types of cases. And in most of the cases where there has been an allergy to it, the majority of the people knew that they had allergies to the substances that were either in the vaccine, these particular vaccines, or that they knew that they were allergic when they took vaccines. And so we just need to be vigilant in the same ways that we have been for this. But again, this vaccine has been shown to be safe, these two, and we should continue to work on that mantra that we really need to really make sure that we on the side of this where it's the benefits and the cost behind the decisions that we make. The benefits so far have been great, and then the cost may be something we need to weigh that, and certainly on your own individual case. But we really need to make sure that we kind of get our questions out there around things such as allergies and anaphylaxis to really look at that. And if you do need to have a further look at that, you know, there are allergists that can look at each individual case to make sure that the right decision is made, because you know, not coming up to bat to COVID is the best thing to have, and the best way to get there is to look at all options.
Thank you. Scanning through the questions, could you speak to over-the-counter meds, vitamins that you would recommend us to take to boost up our immunity?
The way that you boost up your immunity, there's nothing special about COVID at all in terms of what one would do. So the usual things that you do for your health should continue. We should make sure that if you take vitamins for boosting your immune system, there's nothing proven that says these things will make you more immune to COVID. That's not out there yet. So you just need to continue to do those things that you normally would do. So if you're one that takes vitamin C, then do it, but it's not proven. And so, but there's nothing that I can say, take these and then that's gonna change that. So if you want to take some multivitamin every day, continue to do that. So you should just continue to do those things that you normally would do. But then on the side of that, just make sure that you're doing the things that we often recommend, which is making sure you get enough sleep, that you're eating a balanced diet, that you're doing enough exercise throughout the week, and that you're doing a lot of things for your mental health to reduce stress. And so all those things need to continue pre-COVID, in COVID, and post-COVID.
Multivitamin, rest, and
mental health.
Mental health. Thank you very much.
Yep.
Balanced diet.
Balanced diet. Thank you.
Chitlins.
Why is the second? We're hearing that the second dose has a stronger reaction than, or people have a stronger reaction from the second dose than the first. And the second part of this question is, what is the potential for elderly people to actually become very ill from COVID?
Ill from COVID itself, not the vaccine. So in regards to the second dose, the way immunity occurs, the first dose that you get from the vaccine itself, it mounts an immune response. And so the way the immune response happens is that the body gets exposed to the vaccine, you know, the messenger RNA creates that protein that begins to look like to our body like the virus, which really it isn't the virus, and it develops antibody that gets up to a certain level that is able to identify, if you really do get exposed to the vaccine, that it will attack the vaccine, and then there will be a response to that. That whole response has to do with the antibody coming to the virus, then also our cells in our body that fights, our immune cells that fights foreign substances has to play a role also. And so that's called the cellular response. So when you take the second dose, the body goes through an even greater memory process where the antibodies are increased, and also the number of cells that begin to remember what the virus looks like. All that goes on even to a greater discipline. And so the body really charges itself to really do that. So in the process of having that development within your body, the response is a lot greater. And so you could have more tenderness at the site. You could have the achiness that may occur. And that's why that happens. Now, in regards to elderly and having a significant response to the actual virus itself, you know, yes, certainly that does occur. And so again, we just need to make sure that we're doing those things that really mitigate us, you know, connecting and getting the virus and it being able to replicate in our bodies. We really need to continue to do the things that, from a public health standpoint, that we need to do with the mask and hand washing and all that needs to happen. We need to make sure that we're doing those things that help to keep us healthy. That was just mentioned earlier in the previous question. We just need to continue to do that. Be vigilant. There's no room for a break in what it is that we need to do, because at that point, you're able to allow the virus to have an entryway into your body. And that's what viruses do. They look to enter in any way that it can. And so that's why when we speak of, everybody taking the vaccine, that it helps to prevent, because if it gets into anyone, it makes it possible to spread to someone else. And so there are so many ways to be an entry point for the vaccine, and its virulence is based on that. And so we just need to, again, be vigilant and do things over and over, and just kind of just know that that it's going to make a difference in the long run.
Thank you. We're getting a lot of feedback regarding how wonderful this information is. And thank you so much for taking your time to answer these questions extensively. We have a few more. In regards to people with serious autoimmune diseases or underlying issues like leukemia or lupus, would you speak to how these folks should go about deciding if they should take the vaccine?
Okay, right now, COVID doesn't care if we have lupus. It doesn't care if we have, other chronic illnesses. It doesn't care. It's a virus. It doesn't look at you and say, "Oh, I'm going to go somewhere else." So the vaccine, was studied in a population of people that, were able to come up with these numbers. However, for those folks who have certain ailments, then you should still be on the list to get the vaccine. Now, there are ways to take vaccines that make it more plausible that the vaccine works a whole lot better. And so if you are on medications that blunts the immune response, if you do have chronic illnesses that you feel will interfere with you taking a vaccine, then I would consider these to be special cases, but you still should take the vaccine. Your walk to the line to get into the vaccine should be a little bit different, so that we can make sure that you get the response that is needed. So you need to work with your healthcare professionals so that they're able to put you in the best position for you to get the best response from taking the vaccine. But no one has been excluded from taking this vaccine. The studies were done in certain populations, and so we need to keep that information in mind, but know that COVID does not discriminate. It's coming after all of us. And so we need to be able to fight as best we can.
Wonderful. The next question is in regards to, since the administration is concerned that everyone gets at least the first dose possible, does it matter? Oh gosh, hold on. I don't have the second part. I don't have the second part to that question.
Well, let me see, maybe I can kind of comment on that. So I guess the question may be, when can you get the second dose? And so both vaccines, second dose should, the way to think about this is that the way that our body responds to a vaccine, we need to make sure that, if you take the Pfizer, that you don't take it before 3 weeks. So you can't take the first dose and then take the second shot like in 2 weeks. That's not how you would do these vaccines. It has to be 3 weeks for Pfizer or later. For Moderna, it has to be 4 weeks or later. You don't take it early. Again, the body has to learn how to fight. And so when you take the first dose, the body is learning, and let it learn. And then you take the second dose to boost it, to really get those numbers up around antibody and cell memory and so forth, so that you can fight it off. So where's I guess the other part of the question may have been, so how late can we take it? And so the thinking right now is that you don't want the second dose to be 42 days or 6 weeks past for that second dose. So you don't want it to be that much further out. So both vaccines need to be within that time frame. So about 6 weeks is what I would say.
Okay. This next question is related to someone with a serious situation. They had lung cancer surgery. Part of their lung was removed, and they've been in recovery for 3 months. They'd like to know, when would it be safe to take the vaccine? And they're also concerned that they take blood pressure medication as well. So what do you suggest?
Yeah, so if you had surgery, again, the position to be in is to make sure when you take the vaccine, your body is set up to have the best response to it as possible. So again, there are special cases. And so if you had surgery and you're taking medications and so forth, you really need to work with your practitioner around what you're taking, what surgery you had, and the condition of your body. So when you take the vaccine, you'll respond to it. And so I am in no way recommending everybody run and get in line and start taking the vaccine. You should take it, certainly if there are no particular issues, but if there's a certain case, there's a way to really set yourself up to really get the best response that you can. And so the best way to do that is if you do have a special case, is that someone will really need to sit down and look at those medications you're taking, look at the surgery that you've had, and come up with the best recommendation for you that would mirror you having the best result from taking the first dose and the best result taking the second dose. And so it would be recommended that you have a discussion with your practitioner around that. And there's a way to do that. And so that's how I would recommend that you approach that. But absolutely, you should take the vaccine, though. You should take it.
So are there any recommendations for taking a painkiller or drinking lots of water before you take the second dose? People are hearing that there's some recommendations out there.
No, if you have symptoms, then take something. But if you don't, I wouldn't try and pre-medicate myself at this point in time. And you don't want to do anything to thwart your body's response to the vaccines. And so I would listen to my body. If before you take the vaccine, the body likely is not saying anything about it. But if you do take the vaccine and you begin to have symptoms, then take something for the symptoms. Treat what is happening so that you have the appropriate response for what is happening, as opposed to attempting to prevent something that's going to happen, because you want the vaccine to have the best potential to do what it needs to do. And that's what I would recommend.
Kalita, I'm going to have you just scour the questions. We're going to ask one more question, and then we'll close out our time. Again, Dr. Seamster, this has been incredibly valuable. I'm getting text messages from people who are on this, and I'm looking at the comments in the chat. So, you have hit a home run. There's one probably very minor mistake you may have made. Mm-hmm. You said that our bodies have to learn how to fight. Well, Baptists already know how to fight. I'm just letting you know that.
Absolutely, there you go.
So I don't want them to learn how to fight any better, man. It's already rough. All right, Kalita, I should give you enough time, to fight. Deacon Bowman said, "Amen." The Baptists know how to fight.
There you go. Absolutely.
So Kalita, you probably have been able to find one last question, and then we'll close our time out. Okay.
Yes.
Thank you, Kalita.
This one I haven't seen prior. What happens if you are asymptomatic? So you have COVID and you take the vaccine.
If you're asymptomatic, you have COVID and you take the vaccine, the vaccine is recommended for everybody, those that have previously had COVID and those that have not. And so we should all take the vaccine. And so if the question is that if you don't know if you have COVID actively while you're taking the vaccine, then you're really not going to know at that point in time. Will it blunt your response? Hopefully not. What happens when you do get exposed to the actual virus? That means the body is really, again, in the process of making those antibody and having that cellular response where it's a learned thing within the body's immune response. So you should still continue to go through the process and having the first vaccination and the second vaccination as well. And obviously, if again, these are special cases, and so you should certainly let someone know. For example, like the CDC should know. So if that did happen and your practitioner became aware of it, those are reportable type cases. And so it's important that we report all these types of things that occur that are unusual, because that way we learn, and we need to continue to learn, again, because this is a novel virus and it's new to us and we're learning. But certainly you should take the vaccine whether you've had COVID or not. It should be a part of your strategy for keeping yourself healthy.
Awesome. Thank
Dr.
you so
Seamster,
much, Doctor. Go ahead,
I
Pastor.
think that this has been great. Some of the comments have been, I feel more comfortable and confident in taking the vaccine now. People feel they have been informed. And this is not one or two people, this is several people who are saying that. So you have accomplished. I also think that you should consider taking Kalita on the road with you. She's a great question screener, and, and you're a great question answerer.
Sounds great. Yes.
Ladies and gentlemen, we're going to make this available for people to re-watch it, and maybe we can share this Zoom with others, and be on the lookout. We'll try to do some kind of follow-up in the future of things around health and COVID and so forth and so on. Dr. Seamster, is there any last word you have for us as we close out our time?
I would just certainly just say that I think it's important that we really move forward with, taking the vaccines, so be vaccinated. And if there is anything that is between you and the vaccine, I would recommend that you really have a conversation that helps you to understand, to make sure that you are making the best and most informed decision that you can make for yourself and for your family, for your loved ones, so that you put yourself in the best position to be able to respond to this dreaded virus. And that it is important that we also continue to make sure that we are able to really continue to follow the public health guidelines pre and post the vaccine, that we need to continue to do those things that we were doing before, including the mask, including the hand washing, including the cleaning, including the social or physical distancing, and not being in crowds and so forth. And then when new public health dictates come out, please pay close attention to those, because it's done in a way where there's an attempt to really make sure that we are, again, making the best decisions for ourselves and our family and the communities that we live in. And it's very important for us to continue to have forums like this. And so I just like to say I appreciate you all, and thank you for the questions. They were all great questions. And just know that, as a community, that we're all headed somewhere. And, as I say with my family here at home and my church family, that we are all stronger together.
Yeah, yeah. We so as we close out our time in prayer, again, happy birthday to you, Dwayne. Encourage you all to join our Facebook Live for our service. And Kathy Bowman, I'm going to ask you to forgive me on this last comment. When I was dating my wife in college, I used to buy her cheeseburgers from McDonald's. But when I realized that she was special, I jumped it up to Big Mac. And so, Dr. Seamster, I'm gonna buy you a Big Mac because you're a special brother, man. You Big Mac worthy. Come on, everybody, give him a thumbs up for Big Mac worthy. Eh?
Well, thank you. I appreciate it, Pastor Pitts. Thank you so much, and thanks for having me.
Let's pray, y'all. God, we thank you so much for what our ears have heard, what our eyes have seen, and what our hearts have felt. You have given us a sense of comfort through the gift of Dr. Seamster. I thank you for his mind. I thank you for his heart to share. And I thank you for the experiences that you have given him that he has shared with us. God, I pray that you would keep him healthy. I pray that you would keep him strong. I pray that you will protect him and his family from hurt, harm, and danger as I pray for us all. And God, I pray that we will continue to be people of light in the darkest of hours. We love you, we honor you, and we give you thanks. In Jesus' name we pray. Amen.
Amen.
Love you all. Take care.